Welcome to the Concussion Summit. Today we're with Dr. George Michalopoulos, and we're going to talk about concussions and athletics. So thank you for being here today.
Thanks for having me, Dave.
You started off growing up in Canada. You played hockey. How would you say the attitude toward concussions was when you were growing up, and how do you think that's changed over time into the game today?
Well, when I played hockey, that was, first of all, I was a goaltender, so I didn't receive a lot of concussions, but I would see a lot of action on the ice where players would get just broadsided, would have their head down and basically get knocked out, and they'd shake it off. They'd go on the bench. They may miss a shift, sometimes not even one shift, and just be back on the ice. And the attitude back then was there's very little knowledge on what concussion was about and the deleterious effects of it. But I mean, kids would just get back on the ice almost immediately after what now would be considered a pretty moderate concussion. So that was back then. Now things have really changed a lot. We have a lot more data, a lot more information as to a lot of early signs and symptoms of concussion, a lot of things that we can track even on the ice or on the bench. So it's a lot easier for us to say, hey, look, I think this guy got hit hard enough that it might be a good idea for him not to play the rest of the game. They can do more of a full evaluation.
So let me ask you this. Growing up, do you remember seeing a concussion evaluation performed?
Well, sometimes it was as much as holding two fingers up, and you ask the player how many fingers I hold, and if they say two, they're on that shift. If they say three or four, then they might take a shift off. So there were really no, at least baseline testing that was done on ice or off the ice to see if a patient or if a player was concussed or not.
You see a lot of players who have concussions. You see a lot of players who don't have concussions that you run testing. So what are some tests that you do, or what are some things that you look at when you assess a player?
Well, when a player comes in, we basically the tests and the evaluations that we do are the same. If a person's coming in for brain optimization versus a person who got a concussion, we do a very thorough examination and evaluation at our clinic. It's about 3 hours long. A patient comes in, they get what's called a qEEG, which assesses brain function. We do a very comprehensive neurologic examination from head to toe. We do eye evaluation with what's called a VNG, which tests eye function and movement. We do balance testing. We also do vision testing and cognitive testing. We do reaction time, hand-eye coordination. So all these tests together give us information where we can make a determination. Number one, did they get a concussion? And number two, what are we going to do to treat this patient to get him better? So the key for us is we want to get a lot. We do a lot of baseline testing too, so we have at least a baseline for a lot of these players. And what we want to do at the very least is get them back to their baseline and get them performing optimally. I think the biggest thing is we need objective baseline testing. A lot of the tests out there right now are, or at least some of them are very subjective. So we're actually taking the word of the kid. So a lot of the stuff that we do is very objective.
What are the typical symptoms that you see in the athletes with post-concussion syndrome?
A lot of them will complain of brain fog, or they just don't feel right. They're so attuned to their body. They say, "I know I don't feel right," and so a lot of people don't understand what that means. But they might have brain fog, headache, or pressure in the head. Some of them will feel nauseous. They may just vomit in the middle of the night or even during the day. Their balance will be off. They'll have dizziness, sometimes confusion. They're bothered by maybe light and sound that really bothers them. And a lot of this stuff has to do with again, the baseline testing that we do, because we know that, for instance, light and sound go to very specific areas of the brain. So if that's ramped up a little bit, we have to figure out a way to shut it down and help these players get back on track.
Have you seen any difference between concussions in athletes and concussions in people who aren't athletes?
For the most part, they're about the same. But I really think that because a lot of these professional athletes are really, really in tune with their body, just the slightest of them being off, they know there's an issue, so they'll come. Other people that will get concussion, which you could get from a car accident or a whiplash or a slip and fall. They might just think that this is normal healing for me, and they don't realize how much damage they've done to themselves. So they might just blow it off, thinking that it's nothing. Whereas if somebody like a professional athlete that's very, very in tune with their body, and they're getting paid a lot of money to perform at the highest level, if they're off a tiny bit, this could be a big problem for them. So I think symptomatically is probably the same, but the fact that they can tell probably a little bit sooner that something's wrong, and not blow these symptoms off, would be probably one of the biggest differences that we see in our clinic.
Historically, people have thought that over time, these concussions just heal. And the best thing to do is really just rest, kind of avoid stimulation, wait in a darker room, avoid phones and TVs. And that's still a common thought around most people. And so, what would you say to somebody who gets a concussion and says, you know what, I'm just going to hang out in a dark room until my symptoms get better?
That may help. I mean, a lot of times these concussions and these head traumas will their symptoms may go away in a month or 6 weeks or 8 weeks, and they think that they feel better. But what they've done is their brain's actually compensated, and I think the best way for me to give an analogy would be if somebody twists their knee and it hurts. Well, they're not going to walk normal on it. They're going to limp, because when they're limping, it doesn't hurt as much. And eventually, what will happen is the pain will go away, and other people will watch them walk and say, "Hey, why are you limping?" And they don't even know that they're limping because they've compensated so much. So the kind of the analogy there is the brain may heal in, like I said, in a month or 6 weeks or 8 weeks or 4 weeks or 3 weeks, or at some point in time. But really, what they've done is compensated. So it would take trauma of much lesser magnitude for them to really feel the severe effects of a concussion the second time around. So my advice to them would be, look, even if you don't think that anything's wrong, if we had a baseline on them and they slipped and fell and hit their head and said, I'm just going to go check it out, and they had no symptoms, there's a high probability that we'd probably find something that's a little bit off from their baseline. Thought is, even if they have a mild concussion or a mild head injury and they think they're fine, ideally the best thing to do is get checked. And if we had a baseline prior, we'd be able to make a much more accurate assessment and saying, hey, look, a year ago when you came in, this was your baseline, objective baseline testing. And now, even though you don't have any symptoms, these are your findings, which may conclude that you might have a concussion or might have had one at least. So what we can do is try and get you back to where you were, at least to your baseline.
And so, when you look at concussions, what therapies are available for people who have concussions that might not be aware there are therapies that are possible and might think the only thing is to rest?
So the therapies that we do we have a lot of them, and everyone's unique. Some of the very specific therapies that we use are hyperbaric oxygen tests, balance training, vestibular rehabilitation, which means visual training. We have neurofeedback to help recalibrate the brain waves of a patient if they're off. We have vagal nerve stimulation that is very specific to the actual vagus nerve, where we can stimulate up to 80% of that vagus nerve, which causes more of a recalibration of the autonomic nervous system, so the person is not in fight or flight as much when they get a concussion, because it's very common to get concussed and go get this dysautonomic function, which will cause a fight or flight response, and then people stay there for a long period of time. So we want to shut that down and balance everything out for them. We also have off-axis vertical rotation, we call it, which is actually a gyrostim, which spins patients in flexion, extension, right, left, a combination of all of those directions, based on what we find in the evaluation, to try and activate certain areas of the brain. And that's another vestibular rehab rehabilitation that we use.
In conclusion, what would you say to an athlete, whether it's a high school athlete, middle school athlete, college athlete, professional athlete, who's had a concussion and is undergoing symptoms right now and is looking for different treatments or answers of how to reduce the symptoms and get back to playing?
I think my personal recommendations would be, you need to go and get real objective baseline testing that can analyze every corner of your brain. The things that we do exactly that. There's a lot of great testing out there. It just has to be very comprehensive, because you can't miss one thing. And I really believe, a lot of these young kids, young athletes especially, need to get baseline testing so we know where they are before they get concussed. And then we have a good idea of where they were before. Because the one thing that I have noticed in the professional world is, when we do our exam and we do these comprehensive tests, and a lot of these players are very impressed with what we do. The one question they all ask is, well, where was I before this? I can see where I am now. And, my response to them is, well, did you get all these tests done before? And I'd say a great majority of them have not had any of these tests done. And so it's really, really important for these young athletes to get a lot of these baseline tests done.
Perfect. Well, Dr. George Michalopoulos, thank you so much for joining us, and have a great night.
Thank you, Dr. Traster. It was a pleasure.